Hello, this is our presentation on chronic obstructive pulmonary disease. This presentation is brought to you by Brandon Morris, Mylene Ordoneza, Sarah Park, Brooke Powell, and Jovelina Raimundo. Chronic obstructive pulmonary disease is a collection of progressive pulmonary diseases that have a commonality that they produce increased resistance to air movement, an extended delay in expiratory phase of the respiration phase, and it also causes destruction of the elasticity of the lungs. There are three different diseases that follow within the category of COPD. These diseases consist of asthma, chronic bronchitis, and emphysema. Asthma is a chronic inflammatory disease of the bronchial mucous membranes. This basically causes the bronchioles to have hyperresponsiveness and the airways begin to narrow, and basically it can cause impediments of the airway that are reversible by using medications and getting the patient away from the sources of asthma. Chronic bronchitis is the hypersecretion of mucus, and it causes a productive chronic cough. And usually a person is diagnosed with chronic bronchitis when they have a cough that lasts 3 months out of the year, and the cough ends up happening at least 2 years in a row. Emphysema is the destruction of the bronchioles or the gas exchange airways, and it causes a permanent enlargement of the alveolar walls, which is the little bubbles at the end of the bronchioles. For our project, we are presenting a case study of a patient with chronic obstructive pulmonary disease. Our patient is male, he is Caucasian, he is 73 years of age, his marriage status is he's divorced, his socioeconomic class is the patient lives below the national poverty line. His occupation right now is the patient is retired, but previously the patient used to work as a coal miner. As far as habits for the patient has smoked over 2 packs of cigarettes for over the last 50 years, and the patient drinks 1 to 2 alcoholic beverages per day. As far as our patient's past medical history, allergies, and current medications, the following are revealed. The patient has no known allergies, he currently takes no medications, and his previous medical history includes no illnesses. The history and physical findings for our patient include the patient being awake, alert, oriented ×4. The patient denies having any depression, and the patient appears to be anxious during the assessment visit. As far as pulmonary findings for this patient, the patient has diminished lung sounds to all lobes. The patient has a chronic, thick, yellow cough with sputum present. The oxygen saturation for this patient on room air is 89%. The patient complains of chest tightness. The patient has blueness present to the lips. And the patient complains of shortness of breath with minimal exertion, which includes ambulating less than 20 feet, climbing 1 flight of stairs, and with his activities of daily living, such as bathing and dressing. The patient has had numerous respiratory infections over the last 3 months, which includes 6 infections. To continue with the patient's history and physical, the patient has an elevated heart rate at 102. He has normal heart sounds. There's no ec to be heard. The patient has bilateral 2+ pedal and ankle edema present. Gastrointestinal system is within normal limits. Genitourinary system is within normal limits. And integumentary system is within normal limits. For our patient, we decided to order appropriate diagnostic tests for the patient's signs and symptoms. We did a ABG, and his pH was 7.36, PaO2 was 78, PaCO2 was 40, and the bicarb was 24. We also performed a pulmonary function test for this patient, and the test revealed that the patient had increased residual volume, increased total lung capacity, reduced diffusing capacity, and increased inspiratory flow. We also did some blood work, which consisted of a CBC. The patient's H&H was 14.1 and 44.0. His WBC count was 8,000, and his RBC was 4.35. We performed a 12-lead EKG. The EKG determined that the patient had sinus tachycardia with no ectopy present. We also did a chest x-ray, and the findings showed that the patient had enlarged bilateral lungs and a flattened diaphragm that was present.